There are diseases that kill more people in minutes than SARS has in 2 months. It's not just AIDS, which is tough and expensive to treat, but age-old conditions long eradicated from our midst, like diarrheal disease, malaria, tuberculosis. The challenges are numerous, daunting, and distant. Should we care about them here in Minnesota, and for what reasons? Moral, economic, public health, even anti-terrorist? And where do we begin? We asked the question, what should be Minnesota's top concern about global health at one of the world's premier healthcare facilities? This group of Mayo Clinic doctors began with the top 10 risk factors in global health. There really is such a list. It's put out by the World Health Organization.
Over 50% of all admissions are cardiovascular disease related in the U.S. And so this is a very different list from Minnesota, I think.
Some seem very foreign. Iron deficiency, for example. Some much closer to home, like obesity. All are impossible to rank or even separate from one another.
I work in a field where all of these excesses come together. People develop high blood pressure, and that leads to cardiovascular disease. High blood pressure's unique in that it's silent, so that many people are walking around with untreated high blood pressure and at risk of heart attacks, strokes, heart failure, and kidney failure because of that.
There are diseases reflecting our prosperous lifestyle, diseases of a rich society, diseases from infections like AIDS or SARS, and perhaps least understood, diseases of poverty.
I think if you took a snapshot of the globe and asked each of these 10 questions to just get some idea of what the prevalence is, I think iron deficiency would hit the top of the list worldwide. It's certainly not on the radar screen in Minnesota, because iron deficiency in Minnesota really means medically underserved. In the third world, where it's enormously prevalent, it's also not on the radar screen because it's predominantly a women and children's issue, because iron deficiency in men is distinctly uncommon.
I'm told there are 2 billion iron deficient people in the world. As a pediatrician, I care about that because kids don't grow and develop normally. Others will care about it for more selfish reasons and say, if other countries have millions of iron deficient people, they're not as productive, economically they don't develop, and we end up being hurt economically because of that in terms of trade relationships. So I think there are these different interacting levels between us in Minnesota and people in other parts of the world.
Iron deficiency is just the first of many threats to the healthy development or the very lives of children in many countries. I was in Haiti earlier this year to report on the AIDS story. We'll hear more about that later. But perhaps the most memorable moment of the trip was a brief encounter in this rural clinic with the case of Isaac.
Bonjour Isaac. Bonjour Femna.
He'd just been operated for peritonitis, ruptured intestines, a consequence of typhoid. Typhoid, a disease that sounds almost biblical, comes from unsafe drinking water. Barely 20% of Haitians have safe water.
I don't think he's going to make it.
Isaac died 2 days after our visit. He might have made it if he'd come in earlier, but in Haiti there are few roads. It can take days to get medical help. You walk. From typhoid to diarrheal disease to malnutrition, it's easy to see diseases of poverty.
Calories for 15 chips?
In the rich world, malnutrition is turned on its head. One of America's biggest health concerns is obesity.
Obesity is the #2 preventable cause of death in the United States, and that's not too much different in Minnesota.
Obesity may be a disease of prosperity, but ironically, it's found disproportionately among America's poor. More than half of all Americans are obese, as occupations and lifestyles have become less physical over the years and our diet smothered in deep-fried fat. There's a cascading set of health consequences through life. For example, we're already seeing an explosion in childhood type 2 diabetes, the subject of a recent report by my NewsHour colleague Betty Ann Bowser.
The most alarming problem doctors are seeing is the number of children now diagnosed with type 2 diabetes. Formerly considered an adult-onset disease, almost half of all new cases of diabetes diagnosed in children are type 2, and obesity is thought to be the primary culprit.
You know what we see back there? We see all the blood vessels that tell us about diabetes. That? With that, yeah.
Diabetics like 9-year-old Gabriel Garcia face future health risks like damage to the eyes, heart, and kidneys. Every day, Garcia must balance his blood sugar with insulin.
I used to eat pizza. I used to eat hamburgers, French fries, and soda, a lot of soda. Like junk, like chips, corn nuts, M&M's, Snickers, all of that, and I miss it.
It has to do with lifestyle. Obesity, hypertension, some of hypertension, a lot of obesity, cholesterol, a lot of cholesterol issues which lead to big problems down the road, cardiovascular problems, renal problems. The cost to society, the cost to the individuals and their family members are huge.
And why are our health concerns global issues? The Mayo's doctors say it's because our lifestyle, advertised and glorified on satellite television, is one of America's biggest exports.
The increase in obesity over the past couple decades in this country has been tremendous. It's been by about a third, which is a relatively short period of time to see such an increase. There's something in our environment that's changing, and it's incredibly complex. The rest of the world, too, is experiencing the same increase. It's a paradox in that there are pockets where undernutrition exists, but also the prevalence of obesity is increasing in virtually every country in the world except for sub-Saharan Africa and a couple other areas. So Minnesota, the United States, the world is facing this increase.
In the world in 1990, tobacco use caused around 3 million deaths per year. By 1998, it was 4 million. By the year 2010, it'll be 8 million. By the year 2030, it'll be almost 10 million people a year dying from this. And unfortunately, the parts of the world that are being affected most right now are the underdeveloped and developing countries. And the transnational tobacco companies, which are, many of them are located in the United States, are spreading this plague all across the world.
I think the alcohol industry has learned well from the tobacco industry, and Joe Camel came along and helped a couple of generations of kids start smoking.
What has not found their way into third world markets are antiretroviral drugs that have extended the lives of AIDS patients in the West. That's slowly beginning to change. Slowly, a daunting challenge is beginning to seem conquerable in unlikely places like Haiti, which recently received a major grant from the Global Fund to fight AIDS, malaria, and tuberculosis. Haiti is the first developing nation where antiretroviral drugs will be somewhat widely distributed. These so-called cocktail drugs have allowed AIDS patients in richer countries to lead almost normal lives. But they've long been considered too expensive and not feasible in poor countries.
One of the biggest set of myths we're dealing about are about therapy for HIV. It can't be done in a place like this. People don't have other rights. They don't have a concept of time. They don't have wristwatches. The medications have to be refrigerated. It's not cost effective. It's not anything you could ever initiate in a really poor country.
On a shoestring, Dr. Farmer initiated antiretroviral therapy in the late 90s to a limited number of patients. Adeline Merson was one.
117 pounds. First of all, you see that she weighs 117 pounds. And look here, this is when she started therapy. 79 pounds. So, we are a little bit, what's the word, again, as the patients would say, militant about these drugs because we keep seeing these startling responses to therapy. But for people like them, it's either antiretrovirals or, as she'll probably tell you, or a coffin. In fact, that's, that was in discussions with her father. He was saying that he needed to borrow money to buy her a coffin. This is why she was still alive. And I said, well, we got one last trick up our sleeves. She's starting her 4th year of therapy. No complications.
Adeline is now employed by Partners in Health as an outreach worker.
I just pray to God to keep me alive so I can see my children's future, and that I can continue to have these medications so we have a future, and continue to work in this institution which brought me back to life, like Lazarus.
One benefit of bringing antiretroviral therapy to rural Haiti is that many more people are coming into clinics to be tested for the AIDS virus. For the first time, doctors say, people have been able to witness AIDS patients get better.
Suddenly you have treatment and a lot more people want to be screened. You're going to get a lot more people who are negative, who are seronegative. That is, they don't have HIV. And that's where you can start making interventions to keep them from getting HIV.
Dr. Farmer, who divides his time between Haiti and Harvard, says the big challenge is to leap from pilot project to national program. There are myriad politics, for example. The U.S., unhappy about election irregularities, has cut Haiti off assistance programs, including loans, something the Haitians call an embargo. That's hindered progress in Haiti, President Aristide told me, and should be of direct concern to Americans.
People are dying, others are waiting for medicine or food or jobs. So as fast as those who are concerned can work to make it happen, better will it be for 8 million people. Otherwise, what you saw in Florida when Haitians fleeing economic effects of this embargo reached Florida by boat, it may happen again.